Hi everybody, this is Dr. Leslie Blevins with Anilda Clinic at anildaclinic.com, and today we're going to talk about another worst fear whenever you find out that someone feels your child needs therapy, and that one is that you think it means that your child is crazy or something is inherently wrong with your kid. So I get this one a lot, and this is a big one that I have to go through at the very beginning of starting therapy or whenever I've done an assessment for a child. And I think the most important thing that I want everybody to really know is that, especially with children, because of the developmental process, because it's so uneven, and because children's brains are so malleable or they're always changing, that therapy is typically so that we can help a child get back on track. So for many of the diagnoses that we are looking at, or if your child is given a specific diagnosis, most of them in early childhood especially have really good outcomes with strong research-based interventions. And so oftentimes your child will start to see good improvements or even have full remediation back into a typical profile. And so some of these examples might be things like anxiety, whether it's separation anxiety, social anxiety, a general anxiety where your child just kind of has a lot of varied worries. Or it could be things like a language delay. And so maybe your child has articulation deficits where only the people in the family can really understand your child, but nobody else can. Or maybe even in the family, it's a little bit difficult to understand the child. Or even communication deficits where your child isn't speaking quite enough to get their needs met as compared to their same age peers, or they aren't understanding what's being said to them. And so a lot of times that can actually lead to behavior difficulties. Those are two examples, anxiety and language, where we know with good research-based interventions, your child can improve all the way back to typical in many cases, maybe not all, but in many cases. And so therapy is really about just intervening early. It's not about saying that your kid has this permanent deficit that in any way suggests that your kid is, I don't know, I feel like sometimes parents put really strong words on there, but it's hard for me sometimes to think about them that way, because I know whenever I've talked about, even like with my own family, sometimes the way parents think about certain disorders, it's like they're thinking, okay, my kid's brain is deformed or different in some way, and they're going to have these problems the rest of their life. And just many times that's just not true. I'll give you another example, ADHD. The research does suggest a kid would have ADHD if they're diagnosed with it as a kid. They're going to have that pattern of deficits across their life. Sometimes there is some remediation just as the kid is getting older. But overall, they're going to have a pattern of deficits compared to their same age peers. So it might look different as they get older, but if you continue to compare them to their same age peers who are also getting older, they're still going to look different. But what we know is that especially the earlier we intervene, we can help that child to build good attention skills, to develop executive function skills that help them to regulate their impulsivity and inhibit maladaptive behaviors. And I think a secondary benefit with disorders like ADHD or other impulse control disorders or misbehavior-like disorders is that it's also about developing self-compassion and a really strong sense of self-efficacy, that the child understands that they're taking care of themselves whenever they are doing interventions for themselves. Because as your kid gets older, they have to take more and more ownership of helping themselves. And unfortunately, mental health is not treated the same way as medical health here in the US and in many parts of the world. And even though we have laws that say parity is supposed to be happening, it's not happening in practice. And so it's hard sometimes for parents to get the appropriate research-based helpful support until children are a little bit older. But if a child has ingrained inside themselves, oh, it's just that there's something wrong with me, there's something wrong with my brain, I'll never be able to do things the same way my peers are able to do things, it's actually a lot harder to get that kid to take on ownership of doing an intervention and working really hard until they're seeing the success that they would like to see and the parents would like to see. And so I really want to encourage you guys that if you're getting little hints or even just direct feedback that your child might need therapy, that's actually an opportunity to do remediation. It's never meant to say your child has something wrong with them and they're forevermore going to have this wrong thing with them. It's really an opportunity to say, get that support. If you think about other domains of life, like tutoring, if your kid were having trouble in math or reading or something like that, you'd be like, yeah, I'm going to get a tutor for them. Or if your kid's in a sport, if you could get one-on-one coaching, which many of you have, you would totally take advantage of that. In a way, mental health is kind of the next domain that we're starting to see families go for, as far as getting that personalized um, tutoring and coaching in children's executive functioning and social emotional domains, so that they can live their best, most thriving life and meet the goals that they set for themselves. And it's also helping parents to have a calmer life too, because they're better able to use positive behavior management strategies without getting so stressed out, and to also move their children towards the values that they want their family to have. So I think that seeing therapy as more of a tool to work on some of those soft skills that we all need, and research shows helps us to do really well in our work and to make more money in our work, might be an easier way of thinking about it than seeing it as an insult to a child and who they are at their core. Because I personally have never seen it that way. I've never met a mental health professional who has seen it that way. But I think that a lot of people not in the mental health world think that that's what it means. Totally not what it means. I can tell you that me personally, because I work with young children, I never anticipate keeping a client for a super long time. I anticipate keeping clients for probably about 6 to 9 months. And I would say it gets more on the longer side whenever that client is in the upper age range of what I work with. But definitely the younger client, the shorter the duration of therapy, because they can just turn their behaviors around and increase their adaptive skills so quickly. Now, here's the flip side. Sometimes you're going to get feedback that somebody's concerned that your kid has a developmental delay. Now, yeah, that's something that might be a little bit longer in duration, especially if it's something like autism or a genetic disability. Um, Sometimes there are just things that biologically are present in your child, and either we don't have the tools yet to do alterations to support your child's functioning, or we can only do so many interventions that are behavioral and research based that we can support your child, but we're still not really hitting at that core biological deficit yet. I think what's so important to recognize is that, how did you feel about your child before you found out they needed therapy? You loved them. They're super special. They're amazing. And you still feel that way after you found out they needed therapy, or before you found out they had a developmental disability, and after you found out they had a developmental disability. That core heart of loving them so dearly is still present. And so getting them therapy is about giving them a set of tools to help them live the most amazing life that individually and uniquely and very special they can have. And I think, even in that sense, parents go through a grief process whenever it is something that's a little bit more permanent in that sense. But there's so many amazing, awesome things that can come through working through that grief process and learning how amazing your child is, just for being them, that therapy can also help parents with in that sense, which I should probably make a video about, I'm realizing. Maybe I have, I don't know. So anyways, guys, is your child crazy? No, they're not. They're still that very special person that you've always known, and being told your child needs therapy, or maybe you should consider therapy, is usually just a specific way of saying, hey, Let's help your kid with some soft skills like social emotional functioning, behavior management, or executive functioning so that your kid can have a more amazing, super awesome life. All right, guys, you can sign up for learning videos at anildaclinic.com, and I will see you guys next time. Bye.